This was a very traumatic event. We received a large number of casualties at the same time. And in addition to the large number, the severity of the injury was great. One of the key issues with this event, with such disaster, is to try not to panic, because patients arrive, they are all injured, they are all screaming. The approach, the way they are brought in, the excitement that exists, some of them are unfortunately death on arrival. Some of them are crashing and need immediate attention. So it's very important not to panic and follow the ABCs of trauma. We are fortunate in our department to have a large expertise in trauma management. Immediately when this event happened, our disaster plan was alerted and implemented. All the surgeons, residents, medical students, all our teams were made available and went to the emergency room, while we were trying to coordinate between the emergency room, between the patients, between the other treating physicians and the operating room. One of the key issues with this is triage. It's very essential to be able to triage and classify the patients into those who are in a life-saving condition, life-threatening condition. You need to identify the patients that can crash at any time. And of these, you also need to identify the patients that need to go to the operating room immediately. And this is very essential in the mass casualty management. One of the key things was to delegate responsibilities to senior surgeons, and all the senior surgeons were present down in the ER. So within the first 8 hours on Tuesday, we had around 450 casualties. We admitted 70 to the hospital, and of these, about 16 went to the operating room that night. Of these 16, about 9 of them had major head trauma. Few had injuries to the eyes that required immediate attention. Others had injuries to the heart, lungs, abdomen, or extremities that were in jeopardy and threatened. These were really very stressful moments for all of us, because we met a lot of challenges. Patients arrived without being identified. We were unable to immediately register them through our electronic medical record system. In addition, we had the issue of COVID and Corona, because these patients were transported without the appropriate precautionary measures. With the excitement that was going on, people were lifted and brought to the ER. Very few were wearing masks. Luckily, our teams and the healthcare providers at AUBMC were wearing masks, but despite that, the ability of contamination and cross-contamination and exposure was high. But we certainly expected from that day that we're going to see a major surge in the COVID patients in Lebanon in the next 2 weeks, partly related to the reactions of the people and carrying the people and traumatized victim without being able to use the appropriate precautions and social distancing and masks, and at the same time all the social implications that happens after the trauma and people sitting together without the appropriate protection.